Image of normal foot X-ray. Normal foot X-ray. An X-ray is an image of the body in black and white. The dense structures, such as bones, appear white, while the soft tissues are dark. The X-ray is taken by an X-ray technician in a healthcare provider's office or a hospital radiology department. A normal foot X-ray will show 3 images of the foot, one from the front, one from the side, and one from the angle. X-ray images of the foot can be obtained with the use of gamma rays. The gamma ring is the smallest gamma ray and is not absorbed by all tissues. The gamma arcs cannot penetrate through dense structures, shielding the film from the rays. However, less dense tissues block less energy, and the gamma ray image will show this. The gamma ray images are high-quality, grayscale pictures of the bones in the foot. These can show details like the space behind the kneecap and the ankles. X-rays of the foot do not require special preparation or a specific examination, though children may be asked to remove metal or jewelry. If a child is pregnant, she should be aware that she will be exposed to radiation. During this procedure, she or he may be asked to remove all jewelry and metallic objects. This procedure may take up to 15 minutes, but the radiation exposure is usually less than a second. The image of a normal foot X-ray is relatively easy to interpret and does not require any special preparation. However, children may be asked to remove all clothing and metal objects. A pregnant woman should also inform the X-ray technician if she is carrying a baby. The entire process may take about 15 minutes, and the actual exposure is less than a second. This can be helpful for parents who want to prepare their children for the upcoming procedure and explain what it will look like. A foot X-ray does not require any special preparation. A child may be asked to remove any jewelry or other metal objects before the procedure. The radiation exposure is minimal and harmless, but it does not affect developing babies. Therefore, a foot X-ray should be considered for the treatment of pregnant women. A normal foot X-ray can take about 15 minutes, but the actual exposure is less than 1 second. A normal foot X-ray does not require radiation. Although there is a risk of radiation exposure, it is minimal. Radiologists use the minimum amount of radiation needed to create a clear image. A pregnant woman should inform the X-ray technician if she is pregnant. A child may be afraid of the X-ray, but parents can help by explaining the procedure and preparing the child. They can ask questions and discuss what the radiologist is looking for. A normal foot X-ray does not require any special preparation for the procedure. A child's feet are usually not a problem. The X-ray does not contain much radiation, so a child can be scanned while wearing only their socks. Moreover, pregnant women should not worry about the radiation exposure. While the procedure is quick, the actual exposure to radiation is small. The average exposure to radiation from a foot X-ray is only a few seconds. The process of taking a normal foot X-ray is painless and requires no special preparation. The procedure is usually done in the same way as a normal ultrasound. The radiation dose is minimal, and the patient will not feel any discomfort. The actual exposure time may be 15 minutes. If the X-ray is negative, the treatment can be halted. The image is then analyzed by the physician. Despite the danger of radiation, a foot X-ray is a safe and effective diagnostic tool. However, the radiation exposure is more dangerous in growing babies than in adults. If you're pregnant, tell the technician that you're pregnant. The procedure may take 15 minutes, but the actual exposure is just a few seconds. The radiation dose is small enough that it is not harmful for an average adult. Normal foot X-ray, normal foot X-ray, normal foot X-ray.